Ethan Behrman, Left Coast News.
Healthcare and housing are two fundamental components of living, are they not? I mean, you got food, water, shelter, but really healthcare is part of all of that as well. And now that we don't have the Mueller report still, yeah, that's right. Mitch McConnell blocked that in the Senate yesterday. Thanks, Mitch. Thanks for making it so we can't see the Mueller report, which most of the rest of your Republican colleagues are like, yeah, let's see this thing if the president's so clearly exonerated. Well, that was yesterday's dispatch. I talked about the Barr report, but we need to see the Mueller report. We still don't have it. And the Trump administration made an announcement that will absolutely galvanize the center and the left in this country against the Republicans and this president in 2020, because the president ordered his administration ordered the Department of Justice to not defend the Affordable Care Act at all anymore. They were at first just saying, well, we should strike down the pre-existing part. We should, no, none of it. Get rid of it is what the Trump administration's new position is. So 6 years, the Republicans were screaming about the Obama administration and why we had to elect Republicans in 2016. It was repeal and replace. Repeal and replace. They have now just totally given up. Hey, who cares about the replace part? Repeal the sucker. And if you die, you get sick, you have a pre-existing condition, screw you. Go die broke in the streets, be bankrupt, and suffer. That's the message from the Republicans on this one. And the message from the Democrats, and Speaker Pelosi has really been a great leader on this issue, is no, we're going to make sure that our fellow Americans have access to health care. This is exceptionally important. Now, let's go back to the Affordable Care Act again. It actually did a couple of things. It was the law that said you're going to buy health insurance, and the federal government's going to set up an exchange to buy health insurance. Health insurance will be available everywhere. You'll get it subsidized to go buy a private insurance plan. Now, I, of course, at the time argued that we should have a public option. I still stand by that and say at a minimum public option, at a maximum is Medicare for all. But the Affordable Care Act did one other thing that is critical here that does not get talked about. It expanded Medicaid. Medicaid is a federal and state program. It helps medical costs for people with limited income and resources. It also offers benefits that aren't normally covered by Medicare, which is things like nursing home care. That's how the majority of people in the United States who are in nursing homes pay for the nursing home is Medicaid. And personal care services, such as I'm, wheelchair bound, or I'm bed bound and I'm at home. And what the Affordable Care Act did was it was to, obviously reduce the uninsured, but with this expansion of Medicaid, it expanded coverage for most low-income adults to 138% of the federal poverty level. So this was a big deal in expanding health insurance coverage, either through the exchanges or through Medicaid, to say you're going to have access to health care. Now, again, the Republicans are saying, no, screw you. President Trump said he wasn't going to do this, and now he is. So he lied again. And keep in mind that there are only 14 states, 37 states in D.C. adopted the Medicaid expansion out of the Affordable Care Act. 14 states did not. Can you guess which 14 states did not adopt Medicaid expansion, which said, I don't care if you're poor, go suffer and just go to an emergency room, which was covered by President Reagan's order back in the 80s to say emergency rooms must provide coverage no matter what, meaning you're sick and dying, we're going to get you healthy enough to get the hell out of here. That's what our minimum coverage is here in the United States. Alabama, Florida, Georgia, look at this, all red states, Kansas, Mississippi, Missouri, North Carolina, Oklahoma, South Carolina, South Dakota, which is, I guess, red, Tennessee, Texas are the states that said, we're not adopting the Medicaid expansion. If you're lower income, screw you. That's what they say. It's unbelievable. And that's what the Trump administration is saying now, too. Screw you. You're lower income. You're working 29 hours a week. You work two jobs that are 29 hours a week, so they don't provide health coverage. And too bad for you. No preventative care for you. No health care for you. If you're dying, you can go to the emergency room, and that's it. Well done, Republicans, for making it clear what you think of the American people and working Americans. I still argue that we need to decouple healthcare access, healthcare coverage, health insurance from our jobs entirely. There's no, now look, if your job has some great, that's a perk that they're going to use to differentiate themselves, I'm all for that. But basic healthcare coverage in the United States should be Medicare for all, and you shouldn't depend on a job for it. It is economically smart. Free marketers get that in the state of California. One of the reasons this state has been the engine of economic success that it has is because we don't enforce non-compete clauses. So people are able to job hop readily. They're able to go start a job, take their knowledge with them. The same concept applies to healthcare. We want people to be able to jump jobs. We want people to be able to go off and start a company and be entrepreneurs and not beholden to a job because, by God, I got sick once and I won't be able to afford healthcare coverage, insurance, if I leave my job. It's wrong. The Republicans are wrong. The Trump administration is wrong. California has a real housing crisis. We're short 3.5 million units of housing. We've had many, many years of NIMBYism, of restricted growth. Housing is a way to control things. And what it's caused is tremendous income inequality. It's made it exceptionally difficult and expensive to live here because we restricted development. It's basic economics. Economics 101, supply, demand. Demand has exceeded supply now for more than 30 years, dating back to the 80s and the 70s is really when this whole process started, that we said, nah, we're going to cut back on housing because that's a way to control people from moving here and controlling population. Well, guess what? That doesn't work. People still move here. People still come here. While some have left, many more continue to arrive and our population continues to grow. We're at 38 million and counting. Up from 20 million in the 70s, up from less than that before. The point is you cannot control population. So there are people now in this state who are really working to fix it. And I'm so happy to hear people like State Senator Scott Wiener and Governor Gavin Newsom pushing back on the NIMBYs. You can't build housing because that means there are people. Yeah. Guess what? Everything you've done for 40 years to try and stop people from coming here hasn't worked. That includes not developing water infrastructure, not allowing housing, not building out things like roads. Because I've talked to people specifically in places like Santa Cruz on this, where we don't want people to move here. We're going to do this stuff. We're going to stop Highway 17 from becoming 880. So, hey, guess what? So instead, hundreds of people died in car wrecks and people still moved. You're not stopping the flow of people. You are ignoring human psychology, which is we like places that are warm and sunny and beautiful. And so we end up here. I was born here. Yeah, I've heard that argument forever as well, growing up in Minnesota. I'll never forget the cornfields getting plowed under and housing developments built in the suburbs where I lived and grew up. And people, these people don't belong here. Yeah, they do. Because guess what? Did you have more than 2 children yourself? If yes, then shut the hell up. Because if you had more than 2 kids, you're contributing to population growth. Have you fought against making birth control readily available everywhere? Because guess what? People have sex. That Just Say No campaign really worked out, didn't it? No, it didn't at all. And that doesn't mean I don't think people should wait and should be conscious about who they're having sex with and not just sleep around. Yeah, I'm for all of that. I'm also for making birth control readily available absolutely everywhere. So if you've had more than 2 kids, if you've stopped the availability of birth control for an easy price or free, which is really what it should be, then you're part of the problem. So now we have to deal with housing. SB 50 basically says we're going to remove impediments to up to 5-story tall apartment buildings close to major transit stops. It's logical. We're going to spend billions and billions of dollars on transit, and yet you're going to still say, no, we're going to have expansive single-family homes everywhere near that transit so we can never take full advantage of those transit systems we built. And it's an odd group of people. So that's State Senator Scott Wiener who proposed SB 50. That's the transit housing bill that's going to alter zoning standards across California at the state level. I love it. And everybody who's opposed to it is somebody who bought their house 40 years ago in places like Palo Alto and Beverly Hills, because Paul Koretz announced it in the Beverly Hills Courier, talked about that down in Los Angeles. Palo Alto, they're fighting it. Even in San Francisco, in the single-family neighborhoods, like, no, we're not going to allow a 5-story apartment building. You have to do this. You have to allow more housing. The governor is right. The senator is right, because your 40 years of saying no just made it impossibly expensive here, has hurt millions of people, and has made income inequality significantly worse. I'd love to hear your arguments why this is such a big deal. George Skelton wrote about this in the Los Angeles Times. The article, "Big Backyards and Pools Are California's Past. Apartment Buildings Are Its Future." That's right. And I love his first sentence. He's right. You don't need to be a Nobel physicist to figure the direction California must go to solve its acute housing shortage. Guess where I moved my family recently? Into one of these apartment buildings, exactly as the senator and the governor are talking about. So I'm not some idiot that stands around, you live your life that way. Well, I live mine like this. No, I live it too. And we aren't the California ranch lifestyle. It still exists. And those will still be available. But if we're going to spend tens of billions of dollars on transit, then we are going to make sure that there's housing near it, a lot of it. And if we're short 3.5 million units of housing, hey, basic economics majors, you didn't even need to take that. Did you take basic arithmetic? We're short 3.5 million units of housing. What's going to happen to the cost of housing? It's skyrocketing. It's unaffordable. So the bill says local government, you're going to have to do this. Oh, yeah, that's right. Another state senator, Nancy Skinner out of Berkeley, said, we have a statewide housing emergency and we're going to cut the red tape. I love it. We have to do more of this. So while the rest of the country loves to pick on California, it's actually those conservative, NIMBY attitudes that exist everywhere that actually created this crisis in the first place. Does that mean we should get rid of all single-family housing? Absolutely not. But really what it means is, I guess apparently, if you're not wealthy or you didn't inherit the house, you might have to live in more dense housing. That's the reality of it, or go live off in Idaho is where we are. 38 million people and counting. We cannot continue with the single family sprawling ranch house lifestyle for everyone. It doesn't work. So again, congratulations to State Senator Wiener, State Senator Skinner, and Governor Newsom for leading. What do you think about this? I love to hear your arguments or your thoughts, or if your agreements. Comment on social media, of course, on the website, and send me your email, leftcoastnews@ethanbehrman.com.